Hello and welcome everybody to our Aromatherapy patient course provided by AI-PAMI, and my name is Douglas Suffield. I will be leading us through this course today. About the Aging and Integrative Pain Assessment and Management Association, commonly referred to as AI-PAMI. It is a comprehensive project addressing non-opioid pain management in adults 50 and older living in Northeast Florida, with the overall goal of advancement of innovative pain education and patient care through the development of provider and patient workshops focused on integrative pain management. Here is our website, and our contact information is at the bottom. Presentation was developed by Dr. Phyllis Hendry, Miss Amy Kennedy, and Dr. Sophia Sheikh, as well as Natalie Spindle, and reviewed by these representatives of the university as well. My name is Douglas Suffield. I have a master's of acupuncture and oriental medicine. I'm also a diplomat of oriental medicine and a licensed acupuncturist. I am also the PAMI pain coach and educator here in the emergency department in downtown Jacksonville at the UF Health campus. A quick disclaimer is that the Pain Assessment and Management Initiative has provided this material for you and your information to use as an educational resource. It is by no means intended to substitute for the medical expertise and advice of your healthcare providers or prescribed medications and treatments. Quick table of contents. These are what we'll be going through today. What is aromatherapy? What is an essential oil? We'll do some case scenarios. We'll briefly talk about applications. We'll also touch on some research, common varieties and the purposes. Case scenarios will be concluded, safe usage, evaluation of essential oils, and we'll have a reference page at the end. So did you know that there are hundreds of varieties of essential oils? They've been used for thousands of years, dating back to biblical times and even before then, ancient Egypt and Hippocrates, of which the Hippocratic Oath that doctors take today was also an avid believer and practitioner with essential oils. They have been shown to lower stress, help manage pain, and help with other symptoms, as well as raising patients' efficacy and empowerment. So briefly, what is aromatherapy? Aromatherapy is the use of essential oils from plants, and these can be their flowers, herbs, trees, roots, leaves, bulbs, as an integrative health approach to medical treatment. The essential oils are most commonly breathed in. However, they are also rubbed on the body in a diluted form. So we will talk about this at more length, but it is always important to dilute your essential oils. Do not put them directly on your skin. Carrier oils can be used, such as olive oil, sunflower seed oil, jojoba oil is also great, but it is always important to dilute to minimize any risks of skin sensitivity or burns or photosensitivity as well. So what is an essential oil? So essential oil is extracts or are extracts, sorry, from flowers, fruits, leaves, seeds to capture the essence, the aromatic essence of the plant. These oils are usually either pressed or distilled. Distilled does seem to be the better of the two. They are concentrated plant extracts that retain the natural smell, flavor, and are medicinal in their properties. So they have a lot of anti-inflammatories, antioxidants, and all of the healing natural aspects of the plant are even stronger and more potent when they are distilled. So briefly, let's go over some case scenarios. Both of these are specifically focused on pain relief, so they should be very applicable for some of you. So our first case presentation will be Mr. Thompson, who is a gardener by trade, recently retired, and set out to landscape his own home after many years of working for others. However, after a few months of working with his hands, his rheumatoid arthritis became too painful to continue. Mr. Thompson has been going to the same clinic for years to receive routine care, massage, and attending patient support groups. And at his most recent appointment, his doctor mentioned adding aromatherapy to his weekly hand massage treatments, as it could potentially lower the pain and help improve his activity level. Our second case is going to be Mrs. Leary, who is a retired kindergarten teacher. She loves to be outside and taking her dogs for walks, visiting with other retirees, and shopping at her local mall. Lately, however, she has had to cut back on her walking because her osteoarthritis has been causing increased aches and pains in her knees. Mrs. Leary attends the same clinic as our first case, Mr. Thompson, and the doctor also recommends aromatherapy to be added to her pain management treatment. Says it could help her with staying active and may also reduce her pain. So, what the research says regarding aromatherapy and essential oils. So, lavender is one that is used, and a lot of research has been conducted with lavender. It's associated with reduced pain, especially when used before or during routine shots, IV insertions, and trigger point injections. It's also great for relaxing before bed and to utilize to lower feelings of stress or anxiety. Aromatherapy massage with essential oils such as lavender, juniper, lang lang, and rose have been shown to reduce pain and fatigue of patients with rheumatoid arthritis. Post-operative knee replacement patients also reported reduced pain and blood pressure with inhalation of eucalyptus oils. Eucalyptus is also great at opening up the chest and the bronchioles. We see it a lot, or we use it a lot with Vicks Vapor Rub. One of the main ingredients is eucalyptus, and it is also used in steam rooms throughout the world to again open up the bronchioles and increase the ability to take nice deep breaths. For labor and delivery pain specifically, research has identified the benefit of many types of essential oils in reducing the pain intensity during the early labor pain. There's also promising evidence in pain reduction for patients using aromatherapy essential oils with conventional medication therapy for renal colic, hemodialysis, and neck pain. So, again, essential oil is a great addition to a pain management protocol and a pain management plan. It is by no means the only intervention that patients should be focusing on, but it does, again, raise efficacy. It gives patients some empowerment in being able to combat feelings of stress and pain. Essential oils may be promising to use before medical procedures that cause stress and anxiety the night before to get a good night's sleep, or the night after to get a good night's sleep. When we sleep, we rebuild everything from our muscles to our nerves to our, we even transfer memories from short to long term. So sleep is very important. However, there are a lot of things associated with sleep issues such as stress and anxiety. In a study of intensive care unit patients, stress was reduced with the use of lavender essential oil, as was heart rate and blood pressure, signs that it may be a useful tool for relaxation and calming. The other thing naturally that happens is we can all relate to when we smell something that smells good. It can be different for everybody, ranging from fresh baked cookies. Some people really enjoy the smell of barbecue or fresh cut grass, but we naturally take a much deeper breath. On the opposite side, when we smell something that we don't particularly like, something that is pretty pungent or rotten, we immediately hold our breath and we tense. So when we breathe in things that smell good, such as essential oil, we naturally have a reaction to take a deeper breath and to just relax. And once we start to relax, our brain can relax and our mind can relax as well. So a little more research, more about labor and delivery using multiple oils have experienced reduced anxiety during the early stages of labor. Lavender, again, is very important and it improves sleep quality for patients in intensive care when inhaled prior to sleep times. So, briefly, we're going to talk about some applications. Right here, we've got a traditional diffuser. A lot of people see these, they're in the stores. They are a great tool to use. They really help get the essential oil into a space. Another inhalant version would be aromatherapy inhalers. So this is what we're actually using as part of our pain coaching and education program. We're providing lavender oil as well as eucalyptus and lemongrass. So lavender is going to have that sedative quality of helping reduce stress and anxiety. Lemongrass and eucalyptus are going to be more uplifting energetically. Eucalyptus also, again, touching on opening up the bronchioles in the chest. So inhalers are great. They're also called aroma sticks. They're plastic tubes that contain fabric already soaked in the essential oils. Some advantages are that they're very low cost and they are very long lasting. They're also easy to transport. You know, a lot of people, you're not going to pack up your diffuser every time you leave the house. So these are a great way to utilize the same idea with the aromatherapy when, let's say, you're in traffic or on the way to a meeting or after a meeting. It's a great addition and they're very easily transported. However, the disadvantage is because they are smaller, they're easily lost or misplaced. And because you do have to twist them to open, it could be difficult for some patients, particularly with rheumatoid arthritis or arthritis of the hands. So, Aromatherapy Tab and Patch, I have mixed feelings on these. They're small, they're single use, they're adhesive. They do run a higher risk of skin irritation, especially if they're left on for too long. Some patients will put on the skin patches and then forget that they have them on, and so they can lead to some skin irritation. That being said, they do deliver a long-lasting uh, introduction of the essential oils, so they can be very good as well for pain management versus a aromatherapy inhaler that you're having to inhale quite frequently. This is something that you can put on once a day and go about your day as long as you do remember to take them off. Skin application. This is if anyone's ever had a massage. This is something that a lot of masseuses use. They will again dilute. I can't stress that enough to not put essential oils directly on your skin. Some great carrier oils, I'll touch on them again, are the olive oil, jojoba oil, and sunflower seed oil are also great. Castor oil also works, which is very hydrating. Advantages of stress and anxiety reduction, pain relief, decreased swelling, helping maintain skin quality. Disadvantages would be full body massage may be limited by time or physical conditions. Also, you're not going to be able to, give yourself a back massage, but it does really work with rubbing it on your feet, rubbing it on your hands, rubbing it on elbows and knees and achy joints. Diffuser we have spoken about, but it is the most common. It's very there. You can get them on Amazon. You can get them at any big box store, Bed Bath and Beyond, Target, Walmart. I would suggest to read the reviews, but they are pretty much all part and parcel of the same. So you don't have to go out and spend hundreds of dollars for one of these. I'm going to touch on this later, but I would definitely focus more on buying high quality oils, not necessarily the highest quality diffuser. So the advantages are it quickly fills a room with a scent. You can fill it up with water and some drops of your favorite essential oils and lay down for bed. So it will run for an hour or 2 hours or however long you set the timer. You don't have to worry about unplugging it or anything like that. So it is great to get a good night's sleep. Disadvantages is that they do affect others nearby. So some people are a little more sensitive to smells, particularly pregnant women. So I would definitely touch base if you're going to be using this in a crowded area or if there's going to be multiple people exposed to the smell. There is also a potential for a bacterial growth in the water if it's not refilled and cleaned. But however, there is some things you can utilize. So a lot of the essential oils that we'll talk about do have antifungal and antibacterial properties, sorry. So if you do use them, such as tea tree oil is one, you can actually put a couple drops in the water, and that will limit the amount of bacterial growth. So I already touched on it, but tea tree oil is great for bacterial and fungal infections. Tea tree oil is something that is used a lot with acne or facial treatments. However, it is very harsh on the skin. If you do put this directly on your skin, it can be very dehydrating and very tough. So you definitely don't, again, I can't say it enough. If you're going to use it on your skin, you need to dilute the essential oils. Peppermint is great for headaches, fever, nausea, and fatigue. Lavender, minor burns, insomnia, pain relief, and wound care. German chamomile, we've all heard of chamomile tea, so this one's really great at inflammatory skin problems. Bergamot is a mild antidepressant and tonic. It is also great for face and facial treatments. So bergamot, lavender, and a single drop of tea tree oil can be really good if you wanted to rub it on your hands to help with achy joints. uh, Oral health with myrrh, frankincense and myrrh are things that were in the Bible. So they've been around again for a very long time, but they are very good at helping with wound care, especially oral. Do not swallow it. We'll touch on that in a little bit, but I tell all my patients to use it either to breathe essential oils or to use it topically, but do not consume them. They do interact with certain pharmaceuticals, they do interact with children and elderly patients. So we want to be as safe as possible. So definitely inhaling them and putting them topically with a carrier oil is the best and most recommended way. Rosemary is great for cooking, but it also has anti-infective agents. Eucalyptus, respiratory infections, as well as opening up the bronchioles. Ginger is great at nausea and inflammation. So I'm a big sushi fan, and a lot of patients ask me, why is there ginger with sushi? So there's actually two things. Ginger is a great way to cleanse the palate, but also with sushi, because we are consuming raw food and raw fish, sorry, that the wasabi, the hot green horseradish, the Japanese horseradish, is used to kill the bacteria, but ginger is also used to settle the stomach from the impacts of the very spicy wasabi, and also to help kill any lingering bacteria as well. Ginger essential oil is great to rub on your wrists with any type of nausea. So can peppermint be used as well. Lemongrass is for fungal infections. Mandarin is great for stomach upset and restlessness, particularly in children. And valerian root, is great for insomnia. So, for example, if you were to want to use some of these and combine some of them for a good quality sleep, I would suggest a couple drops, 3 drops of lavender, probably 2 drops or 3 drops of eucalyptus, and a couple drops of valerian would be a perfect way to combine those in a large diffuser to help relax before bed. I do also suggest that you find the smells that you like the most. Some patients really enjoy certain smells, some patients do not. So it is very case by case basis and a very personal choice. So I would encourage you to try as many as you can and just figure out which ones you particularly like. So, safe use of essential oils is always talk to your healthcare provider before using essential oils, especially to treat a medical disease. Do not take them orally because they do run the risk of causing serious health effects if they are consumed. Wintergreen and clove oil in children has been shown to be quite toxic. Some of them also, again, have issues with anticoagulants or blood thinners. So again, please do not eat the essential oils. There are some that say they are food safe, but I can't stress it enough that I would stick to inhaling them and using them topically. Again, they should never be put on the skin. I'm kind of, beating a dead horse here, but again, always use a carrier oil. Recommend dilution of 1 to 5%, which is depending on the size of the area you're going to be covering or how much oil you're going to use. It is 2 to 3 drops is all you need to put into a small bottle of oil that you can then use to rub your hands and your feet. Allergies are always a possibility. We never know what we're allergic to until we are exposed to it. So always start with a small patch of skin, dilute it on your skin to make sure that there are no adverse effects before you apply it to a larger area. And also, if you are sensitive to smells, um, do not lather yourself up with these essential oils. You're going to want to, again, waft it. So a lot of patients, they open up the essential oil and immediately take a big whiff. That can be pretty overwhelming. What you're going to want to do is you're going to want to open up the essential oil, so unscrew the bottle and hold it, 3 to 4 inches away from your nose, and use your other hand to waft the smell towards your face. This allows you to get a good idea of the smell without overloading your nose and without overloading your senses. So it limits the risk of having any type of negative reaction to it, such as headache or dizziness or anything like that. They are rare. I'm not trying to scare anybody, but I just want everyone to be as safe as possible. Along those same lines, asthma is not recommended for patients with, or essential oils is not recommended for patients with asthma. There is research out there that shows that it can lead to poor health effects. And also any issues with damaged, diseased, inflamed, burnt, broken skin, you should not apply any essential oils to the open wound or the damaged skin. This would be a great example of when you would want to use a diffuser. But again, diffuser with asthma, that would be counter intuitive, and you wouldn't want to do that. So, age, young children and older adults can be specifically sensitive to essential oils. So again, always being careful to keep them stored out of reach of young children to avoid any potential exposure and sun exposure. So some of these, if they're used specifically for facial treatment, we can use a drop of tea tree oil with some lavender, some frankincense on the face. Just with my own private practice as an acupuncturist, do not put eucalyptus, do not put peppermint, and do not put anything near your eyes or your mouth. They are quite intense and they do not feel very good. So if you're going to be using this on your face, lavender is just a great way to go. Lavender and frankincense would be plenty. You could also put a couple drops of bergamot in there. But they do run the risk of being photo sensitizing. So if you were to put it on your face and then walk outside, you can result in some burns to the skin just because it is opening up the pores and creating, not really creating a barrier between you and the sun exposure. So always make sure that you're wearing sunscreen or a hat if you're going to put it on your face and leave the house. All right, so let's return to our first two case presentations. So, Mr. Thompson, the therapist used an ointment containing lavender and spearmint for his hand massage. Mr. Thompson likes the relaxing smell and the warmth that the oils gives to his tired and sore hands. Once finished, Mr. Thompson was given the remainder of the ointment and instructed to use 2 to 3 times daily. Upon Mr. Thompson's return for his 4-week follow up, he reported using the lavender and spearmint essential oils daily, and he felt like he was more helpful than massage alone. He's happy to report he's now finished his flower beds and will be starting on his backyard. And Mrs. Leary, therapist used an ointment of black seed oil and 2.5% of ginger and rosemary. After treatment, Mrs. Leary was instructed to use the ointment 3 times per week. Upon her return for follow up, Mrs. Leary stated that the use of the ointment was more beneficial than simply massage. And she stated that she couldn't believe how much farther she could comfortably walk since starting the ginger and rosemary essential oil regimen. All right, so a question that a lot of patients and a lot of people ask me is how do I safely buy oils? So you get what you pay for. You always want to make sure that your oils are in either blue, brown, or green glass. If they are in clear glass, the problem is any light, any sunlight will actually um, break down the oils. So it removes their potency, and really the highest quality products are always going to be in these brown bottles. So it's a really quick way to check to see if it's a good quality product. Um, I know it's easy to, I don't know if anybody else is, but I love TJ Maxx. I love Home Goods. Always find some really nice stuff in there. I have seen that they do have essential oils. I would not recommend buying essential oils from places like TJ Maxx, Publix, Walmart. They are not going to be medicinal. They are not going to be to the grade that we want them to be. They also traditionally will have a lot of additional chemicals in there, some of which are not even essential oils. There could be hydrocarbons, alcohols, um, a lot of other additives in there as well. So, especially if you're going to use them on your skin or if you're going to breathe them in, you want to make sure you're buying high quality oils. So, always review the label. It should include the Latin name of the plant, and it will tell you the purity and other ingredients that are added. Uh, And it should also have a section of where it was grown and what country it was grown in. Just because an oil says it's pure or therapeutic or aromatherapy grade, there is no regulating body verifying these claims. So that's another way to kind of see if it is a quality product. The company details, if you can review the information online, you'll see reviews and you can check to see that they are a reputable dispenser and a reputable company. Again, talked about the packaging. So the small brown or blue or green bottles are great. Plastic can break, so usually they will be in glass and they will be one of those colored glasses as well. There's a big misconception between fragrance, perfumes, and essential oils. So, yes, some perfumes do have essential oils in them, but you do not want to buy fragrance or perfume oils that are made of essential oils. They do not hold the same medicinal value, and they can actually be quite pricey compared to getting pure essential oils. So look for bottles that contain 100% of one single essential oil rather than a blend. Pricing, essential oils can range in prices based on how much plant matter is in them. For example, rose is the most expensive. It takes about 10,000 roses to make a very small bottle of essential oil. So, very good high quality rose is quite expensive. Same thing with sandalwood oils. But sweet orange, frankincense, lavender are not as pricey. And I'm not saying which way for you to go. If you'd like to spend the money on the rose, it's wonderful. It's a great smell. It's one of the oldest essential oils used. It was used in Greek and Roman times as well as in Egyptian times, but there is a cost associated with it. And then when shopping online, consider companies that can provide a batch label and analysis. It's called a GC or an MS, and it helps show how pure an oil is. So, a couple quick discussion questions before I leave you is: have you ever used aromatherapy before? Did you happen to find any specific benefits when using essential oils? Do you see yourself exploring this topic further? And would you feel comfortable asking your healthcare provider about aromatherapy? So, thank you very much. I really appreciated your time. If you have any questions at all, we have our phone number here, our direct email, as well as our website. And I encourage you all to stay healthy, to stay safe, and to take care. Thank you very much.